Hi, my name is Mary Frischman, and I will be doing an assessment on Sam Hamilton, who is a 25-year-old female. So we came in, gathered equipment, provided privacy. I will perform hand hygiene. While she was walking in, we observed her gait, so she's got good range of motion. Sitting here, she doesn't have any involuntary movements. Her personal hygiene looks good. She doesn't look disheveled. Her clothing is appropriate for the weather outside. Her skin color is good, pink and warm. I'm assuming warm, but it's pink. Her mood and affect is appropriate for the situation. So we will start off with the head. So we'll just go ahead and palpate for any lumps or bumps or masses, and wasn't any. And then we'll do the temporal arteries, and then the temporomandibular joint. Any popping with that? Crepitus? Okay, no crepitus was felt. We will go ahead and I'll just do the cervical lymph nodes. Okay, and none felt, so that's good. So we will then go to the eyes. Also, when you're looking at the head, you want to make sure that she's got good facial symmetry, which she does. So with the eyes, we will do the coronary light reflex. And with this, you're just looking to make sure that the light is reflecting off the same area on the cornea, which hers is. We will do the pupillary light reflex next, so just stare right at my nose. And then we will do accommodation. So just stare at my finger, and then at my nose, and then at my finger. Good. So what we're looking for there is her pupils constrict whenever looking at an object closer, which hers does. Also, you want to note pupil size. Hers is about 4 millimeters, which is normal. And then her sclera are white. Her conjunctiva are pink. They're good. Next, we will do the 6 cardinal gazes, so just follow my finger. Good. And then I will do the cover test. So, okay, and that doesn't indicate any muscle weakness. Next, we will do the confrontation test. So whenever you can, I'm just going to test your peripheral vision. Whenever you see my fingers, just say yes. Yep. Okay, so her peripheral vision is intact. While I'm back here, I'll go ahead and palpate for her thyroid. Okay, and then also with that, the trachea is midline. And then also while I'm back here, I'll go ahead and just do the whisper test for the ear. So just cover one ear.
Banana.
And then apple. Okay, good. So she heard both words correctly. Next, we will do the nose. And then the mouth, and lift your tongue up. Okay. So also with the nose, occlude one, and then there we go. So both nostrils are patent. There's no septal deviation. When you look in the mouth, you want to look at the buccal mucosa, teeth, gums. They're pink, moist. Everything looks good. No signs of gingivitis. And then we will do, gag reflex, so say ah.
Ah.
Okay, so her uvula went up, so it means that her gag reflex is intact. We will go to the ears next. And in conversing, have you had any trouble hearing? Okay. So for adults, you pull the pinna up and back. And then you're looking at the tympanic membrane. You want it to be a nice pearly gray, which hers is. And then you're also looking at the ear canal. Looking at the color, hers is pink. Also the amount of cerumen, which is earwax, which she doesn't have much, which is normal. Also, her ears are symmetrical, and it does appear that she has piercings, and those look to be well cleaned. Next on the neck, we will palpate the carotid pulses. And both of hers are palpable. And then range of motion. So just can you tilt your head, chin to your chest, and then head back, and then side to side. Any pain with that? Nope. Okay. And then just kind of push against my hand. Good. So she's got good muscle strength in her neck. Next, we will go down to the chest. If you could turn so your back is towards the camera. Thank you. So first, we're just looking at expansion of the chest. Hers are equal. Also, you can assess expansion by that, and then your hands go up and down equally, which hers did. So I will be listening to your lung fields every time I place my stethoscope on your back. Just take a deep breath in. Okay, so lung sounds are clear. So now every time I place my stethoscope on your back, just say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, and the 99 was muffled, which is a normal tone. So now every time I place my hand on your back, say 99.
99, 99, 99, 99, 99.
Okay, and vibrations were equal bilaterally. Also, while you're back here, you want to palpate for any masses, any tenderness. No masses are felt. Do you have any tenderness?
Nope.
Okay, so you can go ahead and turn around to the front. And normally on the chest, you will auscultate. You'll listen to the front and then also do the bronchophony too, but we'll just do the heart sounds for time purposes. So we'll do the aortic and the pulmonic, tricuspid, and then mitral. And then while listening to the mitral valve, you want to listen for apical rate, which is her rate and rhythm were regular. And if you have any murmurs, you'd listen with the bell of your stethoscope, which she had none. Next, we will go to the arms. So looking at the hands, her fingernails are clean. She's got cap refill less than 3 seconds on each side, which is good. Radial pulse is good, bilaterally equal, and then her brachial pulse is good. So we're just going to test the strength and motion of your hands. So just tilt your hands in and out, up and down. Good. And spread your fingers out and try to resist. Good. Now squeeze. Okay, so she's got good muscle strength in her hands. Next we will go to, and then to range of motion of the arms. So just raise your arm up and then slightly back. Good. And on the other side. Okay. And then to test shoulder, just reach back with the opposite and then under. And then there we go. Good. All right. Now we can go to the abdomen. You can lie down on your back for me. Okay, so on the abdomen in the clinical setting, you want to pull up the shirt, look at contour, symmetry, skin characteristics. Her umbilicus, make sure it's centered and not protruding, and then you want to look for any pulsations. Next, you auscultate bell sounds. Her vowel sounds are normal active. Next, you will do any vascular sounds. And no vascular sounds were heard. Next, you will do palpation. Start off with light. Any pain and tenderness? Okay, and then you'll go deep, looking for any masses. And then next, you can feel for the liver. So we'll do the hook test. Can you take a deep breath in? Good. And then you'll palpate the spleen. All right, good. Also, while you are laying on your back, I'll go ahead and assess the range of motion in your hips and knees and ankles. So if you could just raise your foot up, good, and then on the opposite side. And then could you bend your knee? Good, and then keep it there. And now bring your hip towards your opposite leg, like this. There we go. There we go. And then out towards me. Good. And then on the opposite leg. And then with your ankles, can you, there we go. And then also while here, if she had her shoes off, I do the Babinski reflex up and like that. And the normal sensation for adults is to curl the feet inward. Also, okay, you can sit up, sorry. And just dangle your feet over to the side. Here you want to assess for your pulses, so you'll go back. No, it's fine. So popliteal pulses are good. You take your shoes off normally in the clinical setting and palpate dorsalis pedis and then posterior tibial. And I can actually do posterior tibs that are equal bilaterally. You also want to assess skin and then no varicose veins. She's got good distribution on her hair. Skin is pink, warm, and dry. There's no ulcers, sorry. And then you can also do, while you're here, reflexes. So first we'll do the brachioradialis. Okay, so you watch for the twitch in the thumb, and then your knee. There we go. Sorry. And then the Achilles tendon. Sorry. No, you're fine. Okay. And then also, while we're here, we can do I'll have you stand up. We'll do, watch your gait. Okay? So her gait is normal. And then we can also do the Romberg test while we're here. So close your eyes and arms straight out. You're going to do this for about 20 seconds. You want to make sure that she's not drifting or swaying too much. And then also, normally hands go back up when you do that. So that's fine. Okay, and then sit back down. We will do neurologic tests now.
Jerica, 67, please. Jerica, 67.
Oh, sorry, stand back up real fast. And then turn around, bend over. So she's got good range of motion in her hips. You're looking at her spine, looking for any scoliosis or kyphosis, which she does not have. Okay, and then now we will do the finger to nose. So touch your finger to your nose, and then touch it to my hand, and then back to your nose, and then back. Good. Now rapid movements. Good. Okay. And then last we will do the sensation. So just tell me if you feel a soft or sharp sensation. So close your eyes. Okay. And then keep your eyes closed and then point to where I'm touching. Good. Good. And that concludes our physical assessment.